Hello, so this is my Sbar for 22522. This is considered one of my Tanzania days. So I'm going to choose our first community day in Runagai, Tanzania. So again, this was our first day there. Who did I work with? So we had Dr. Rob, our travel director, Mara, and then Shannon from the other group, and we had a mix of healthcare science peers, nursing peers, and then we had two RNs who were alum of Cedar Crest who work out VHN. We also had our host Teddy, and then I believe 3 translators. So that's who we worked with. What did we do for the day? So the community day was meant for us to go out into their community and assess some of the needs. So we all met at the church in the morning. We got split up into groups. I believe there were 4 groups. I was with Shannon, our travel director, and one of our peers, and our translator, Inu. So they also had, from the community, we had the priest come, and he was the one who we kind of set everything up with, and he had 4 of the community elders come to us, and one elder would go to one group kind of thing. So these elders are looked up to from the community, and they're also the best source of information. They know who is sick, who is the most sick type of thing. So our elder took us to the first house that she knew of that had quite a few people who needed to be seen to. So we went to the house, and we were immediately swarmed by a lot of kiddos. I would say about 15 to 20 of them came and surrounded us. They were very sweet, just curious because we're new to them, we're dressed differently. They were wondering why we were there. And they also saw that we had bags full of goodies. So we then had a sheet of paper with us that we would ask background information like name, date of birth, if they've had parasite treatment within, I believe it was like within their history. If they drink, if they have substance abuse, what their level of education is, etc. So we would ask if someone was wanting to seek help, they would come to us, and then we would just kind of go through the background with them. They would also give their chief complaint as to why they want to be seen, and then we would give them a little slip with the time on it to come and see us. And we did that for each household, and yeah, it was a really interesting experience to be able to observe their community and what it was like. This was kind of observation and participatory, so we definitely observed their houses. One of the groups got to actually go into the house because the person was willing to invite them in. I was able to just kind of look into the house. So we were able to see that the way that they cook is some of these houses would have open fire pits in their house, which was very interesting and different to see. They also had a lot of chickens running around, going in and out of the house, stuff like that. In the other community that we went to, which I won't be talking about, I was in a group that got invited into a house, and we also got to see the use of mosquito nets, which was really important, and I was glad to see that. In terms of participation, we were the ones doing the background assessment on these patients, so that's how we participated. So what course objectives did I meet? I met quite a few, but I'm only going to talk about 2. So number 6, use appropriate community resources in planning, implementing, and evaluating a plan of care for families and communities. So basically, we would look at the resources available to them, like their water supply and stuff like that, how they're living their life, and then carrying out appropriate referrals to community resources. So we were there to carry out referrals for those patients who are sick, for the doctors the next day when we were there for clinic. The next one would be course objective number 8, so analyzing the community health nurse's role in emerging patterns of regional, national, and global health of care. So basically demonstrating adaptability required in community health nursing. This was a very important time to be adaptable and flexible. We were in a whole different country, a developing country, and it was important to have them feel comfortable in coming to us and talking to us. When we, even though we had the translators, our group really tried to speak in Swahili to them, even if it was a little bit rough. It was so that we could try to connect with them, which is really important. So yeah, overall this was a really great experience. For recommendations, I don't really have any. The only thing was the first community day. It would have been nice to actually go into the home, but I ended up going into a home in our next community visit, which again I won't be discussing, but that's all dependent on if the patient is comfortable to invite us in. But other than that, like, I don't really have much recommendations. It was an amazing experience that will follow me, so yeah, can't wait to talk about more. Thank you.